All right, I'd like to welcome everybody. Today is, what is it, 5th? The 6th, June 6th, for a special board meeting. And yeah, we'll just go on to new business.
So thank you all for coming here last minute. And I think you've probably already seen what's been going on in the media, and the health district has been very engaged in trying to help the community in Findlay, along with you, Commissioner. But what we wanted to do, since there's been a lot of action going on our end, as well as kind of that multi-agency response, we wanted to put all of the Board of Health together, those that could be here today, present to you what we've been working on, what's been going on, also share with you Dr. Krieger's perspective. Don't know if there's any action necessary that needs to come out today, but maybe as the conversation continues, if we want to do something, we've got Chris Mertens here with us on the line in terms of legal. But if you guys are okay with it, we'll just start with an update of what we've been working on.
Sure.
Okay, Aaron.
It's gonna be quite an update.
Oh.
Thank you for allowing us to come update you. I do have some notes because the amount of work that our team and everybody has done in the last week, there's no way I can keep that in my head. So forgive me if I'm looking down a bit. Okay, so a little bit of a brief situation if you haven't seen in the news. For those of you who have been directly involved, on April 21st, the Lineage cold storage facility in Findlay burnt down or had a major fire. So that is, if you're counting, almost 7 weeks ago, and it's still smoldering and has pieces of it that are actively on fire. We became more actively involved when it became clear that the fire was going to continue past what a normal response would be. Typically, with a fire of that nature, when it goes out, then we would kind of, once the fire district stands down, then the health department would stand in to say, deal with any environmental issues that may come about, any solid waste, any water quality. But it became clear about mid-May that wasn't happening and that the fire was continuing. So one thing we did was coordinate the town hall meeting with multiple partners. So again, thank you to Benton County for participating, Benton Clean Air. The fire district has been really engaged and coming together for hosting that town hall meeting in Findlay last week. So I wanted to kind of couch some of the updates today around just a framework of both what we can't do as a health district in this situation and what we can do, what we have done, and what we're doing in the future. So to be clear, what we can't do is we can't put out the fire. We wish we could, but we can't. And it's very frustrating, I think, to the citizens out there that that a lot of people's hands are tied on that issue. What we can do, so kind of our role and authority in this, obviously our staff acting under your direction of the Board of Health and the health officer, we can enforce local public health statutes. We have authority over prevention and control of nuisances that may impact the public's health, and informing the public as to causes, the nature and prevention of disease and disability. So this becomes really complicated in cases where human health risks intersect with the environment, like air and water, because we have to work with a lot of different partners because everybody has a little piece of authority, ecology, us, Department of Health. So we've been doing that a lot in the last week, is coordinating a lot of response and prevention efforts with other partners. We do have some specific authorities and enforcement areas in this issue. We have specific enforcement authority over solid waste. So everything that's left on the site, all the food, all the scrap metal, everything that comes out of there, we have a role in enforcing that's taken care of safely. We do have authority over small community water systems. So what we'd call a Group B water system. We do have a few that are nearby. So we have a vested interest in making sure that whatever is coming out of this incident does not make it into those community water systems and contaminate those. And that'll be a more long-term prevention effort, which you'll hear about. Okay, so what have we done? Some of you may have seen the town hall. Some of you may have been fortunate enough to be on the panel of the town hall. And there was a lot of emotions. There was a lot of frustration. And it was a great opportunity, I think, for everybody to come together and hear what that community needed, for us to be allowed into the community out there, for them to kind of air what it was they needed. What came out of it, the community made it very clear that they needed not only relief from the smoke, again, unfortunately, something I can't provide, but they needed resources to live more comfortably in the meantime until the fire's out. They needed assurance that environmental impacts are being mitigated and monitored for their long-term health. they needed data transparency and some sort of mechanism for their concerns to be heard and, you know, and just collected. And those are things that we can get involved in, and we have. So we heard also from a lot of the citizens that were what we would consider sensitive or extremely sensitive to smoke, some of our more vulnerable populations that either due to life circumstances or pre-existing health conditions that they needed help. There were a lot that were relaying that they were experiencing some severe medical issues due to the smoke, the ongoing smoke. And that was especially concerning for us, given the nature of the air quality for those that are living closest to the facility. So since then, that was last Wednesday, so not even a week ago, here's what we've done, kind of categorizing by their concerns. So in order to provide systems for citizens to be heard and for their concerns to be captured, we've stood up a lot of new information systems. So our amazing communications team developed a new website the next day, a new webpage the next day. We reactivated some emergency contact emails so the public can communicate with us regarding urgent needs. So we've had a lot of people emailing in, saying they're homebound and they need supplies. So we've been able to provide for that. We've been posting or will be posting weekly situation updates on the website for the duration of this incident because we are activated into our incident command structure right now. We have procured and posted information that might be helpful to this particular community because they're, you know, it's every community kind of has their unique nature. So we've had to go out and find information on things like how to keep your animals and livestock safe during smoke events. So we've tried as best as we can to get information that's very particular to these citizens. One citizen at the town hall brought up a desire for epidemiologic collection systems. So a way to, how do we report our symptoms? If we're experiencing these, who's hearing them and how do we report them? And we really wanted to make sure that we could do this in a meaningful way. So our data epidemiology team in the last week has made a lot of contacts, a lot of reach outs to others at Department of Health. Department of Health has since reached out to CDC and their toxic disease group, and just are discussing ways to maybe do kind of a boots on the ground collection approach to make sure we're capturing a full picture of the impact of the incident on the community's health. So that's something that's in the works. And then our data epidemiology team also has worked with epidemiologists from DOH to assess what's called RHINO data. So RHINO is an acronym for Rapid Health Information Network. It's a syndromic surveillance system that essentially pulls in data from emergency department visits and things like that to see if we could see any trends. Unfortunately, we couldn't see any significant trends because of the small numbers in this community. But that was one avenue that we went down just to see if we could notice any trends out of that. Majorly, we've put a lot of our efforts in the last week into providing those supplies for the community members to just live more comfortably or more safely until the fire can go out. So the next day after the town hall on the 30th, we had teams out scraping all the the Lowe's and home goods stores in town. We reached out to the Department of Health and their medical logistics supply as well. We were able to procure about 5,000 masks from various locations. The county pitched them in as well. So thank you for that. And staff coordinated a drive-through mask giveaway the next day in partnership with the fire district, and Benton County, and then Riverview High School provided us their parking lot for that flow there. And we were able to give away about 350 masks and have a lot of good conversations with the community and just hearing a little bit more about what they need. The next day, we procured from Department of Health's Medical Logistics Supply 95 portable air cleaners, so HEPA filter units, and we also got 95 box fans and filters from around town, purchased with BFHD funds. And then we did another drive-through on that Sunday. We ended up on that drive-through giving away everything we had, all 200 air cleaners, and approximately 1,000 more masks. And I mean, we didn't even last till the end of the scheduled time. And we were out, we were busy. Yeah, and again, a lot of people coming through. At that point in time, we had already set up our email and our information system for our homebound residents. So we had people coming through saying, hey, I know I have a neighbor and they can't get out of their house. So during that event, we were also taking down names and sending staff out to deliver to houses as well for those that were homebound. We heard a lot of those concerns, a lot of concerns about their own health for people who were sensitive or vulnerable, but a lot of people just caring about their friends and their neighbors who may be vulnerable and may not have avenues to get out. So one of the things that it is sort of our next step, because we already put in an order for 200 more portable air cleaners with the medical logistics supply. We're just waiting confirmation of a shipment date on that. And our top priority with those is going to be caring for those vulnerable populations first. So some steps we've taken just to prepare so we can do that quickly when they come in is we've coordinated with our in-house WIC groups to get to reach out to clients that might be in the area because they're going to have small babies in the home. We've contacted Meals on Wheels and they've agreed to take some units and some supplies out to, they have approximately 30 clients in the area. So we're going to get some supplies out through them. And then again, we've had those personal deliveries going. And in the last couple of days, we've had about 15, I think, people call in and put their name on the list for delivery for when we get the supplies back in. Anything left after that, we will probably stand up an additional drive-through event and just give the rest of it away that way. And then hopefully having some, going into the future for other people who call in and contact us. Data transparency was a big thing with the public, and that one is a little bit more challenging because we're not the one doing the readings out there. So the map that you have in front of you, you see is the map of all of the locations where the Department of Ecology are doing air quality monitoring. They did come in at our request. So the team that actually was the rapid response spill team, at our request, they stayed behind and continued to do air quality monitoring. At the time we did the town hall, they had 5 sites and the community was concerned because they felt like they were missing there were some gaps. They felt like they were missing some sites on the north side of the facility. So Ecology has increased the amount of sites that they are monitoring at. So they now have 8 permanent sites, including one in Burbank, because we did have some Burbank residents show up as well. And they're also doing roaming locations. And then there's 2 monitors on there you see that says, one says to Burbank. That's a permanent monitor that's been in Burbank for years. And then the one at the Finley Middle School is also a permanent monitor. So they have about 10 different areas now where they're monitoring.
One question they had too, and I can't remember the answer was from Ecology, because some of the people were curious about why we didn't have these monitors out, a week after the fire, 5 days after, I can't, do you remember what Ecology's answer was on that?
Well, they were monitoring immediately after the fire. They were monitoring for ammonia. They're monitoring for the more dangerous things. Yeah, for the really critically dangerous things immediately, like 4 hours after the fire. And particulate matter wouldn't usually become a concern until it's a long-standing issue. So then again, once we noticed a couple of weeks in, this isn't going out, then they're coming in saying, yeah, we should probably look at particulate matter because that longer exposure is where you get to those concerns. One challenge though, a challenge with data is that the readings that Ecology is taking here, they are 5-minute readings. They're doing it around the clock, but they're in 5-minute increments. So they're not intended to provide an indication of, they are intended, to provide an indication of conditions to local residents that are exposed, but they're not a direct correlation to AQI, which is the reading you usually see on EPA or Ecology or DOH's website. AQI is what we use to match up to, if air is at this AQI rating, you do these health, these measures to protect your health. So the concentrations they're getting here take a little bit of calculation to get to AQI because AQI is a 24-hour exposure reading. So it is not easy for us to just provide this data in a subset to the public because it wouldn't be meaningful. And sometimes you can do more harm by providing data that's not meaningful. However, recognizing that that was a concern, we did reach out to Department of Health and Ecology to talk about what we can do to get meaningful data to the public. We identified that we needed more monitors in place that would do static 24-hour readings so that we can get really clearly to those AQI readings and the community can make health decisions a little bit quicker. So on Friday, we got Department of Health to agree to send us for free 15 what are called purple air monitors, and Department of Ecology ordered 15 as well. So purple air monitors are a consumer facing air sensor monitor. So it's an air quality monitor. They're $200-300 a piece. And they will affix either to residential homes or businesses, so long as the owners agree to participate. And then they will monitor for that particulate matter, the PM 2.5. The data from those is automatically pushed onto Purple Air's website and onto, after a short lag, they're pushed onto the EPA's fire and smoke map. So it's data that we can get in a much more concentrated location, and then people can have direct access to it. And there's already correction factors applied, so the public doesn't have to do that math in between to get it to that AQI reading. So that will be really positive. Right now, on Tuesday, Ecology and us and DOH did a training for our staff on how to assemble them, how to set them up, because they're quite complicated to set up. And then we've had amazing partnership with Benton-Franklin Fire District. They have done what we did was we created, or Department of Health helped us create a map with some concentric rings around the facility. So there will be 3 rings that we're monitoring. We're going to set these monitors up in, one close to the facility, one a little further out, one about as far out as the middle school. And then the fire district took that map and they're helping us identify, yeah, I think you could call this person or this person. And they're helping with some of those local reach outs. So that's been really pivotal in helping to set this up. And just really getting residents involved in the data and involved in it. So, to give them a little bit of ownership over it as well. So that is kind of one of our big next steps. Is we are just waiting on, it sounds like right before this meeting, I got an update that our hotspots for those, because each has to have a hotspot, are in and are now functional. And so tomorrow we'll start getting those out into the community and get them set up. Lastly, on data, water quality, we did talk a lot about water quality sample. We're still awaiting the full battery of sample results there, but we have, I made some connections yesterday with some specialists at Department of Health, and we'll be pulling together a team of Department of Health, Ecology, and us to develop kind of a similar to what we've done with air monitoring. We'll develop a water quality sampling plan that will provide assurance to homeowners that we will be doing ongoing monitoring of water quality. And we'll probably then, as we reach out to those homeowners for the Purple Air monitoring, use that as an opportunity to sort of recruit for people who are willing to participate in water quality sampling as well. So that we can just kind of keep a watch on those wells nearby to make sure there's no impacts from this. And if there is, that they get the provisions they need to have clean water. I know this is a lot, sorry. Okay. Next, what we're planning is, our next step really are just prepping for those giveaways, prepping for getting all the next injection of portable air cleaners out to those sensitive and vulnerable populations. And in communication with the facility, we have had a little bit more thank you to, the county and some county leaders who have come together with us to reach out to Lineage. And we have seen a little bit of movement from Lineage's engagement. So they've been a little bit more engaged. I want really quickly to talk just generally about what we are seeing though data-wise with air quality around here. So over the weekend, I want to give a little bit of context for our air quality standards. One of the documents where our air quality standards are set is called the Northwest Area Contingency Plan. So in that plan indicates that the hazardous category, which is the highest category on their chart, is a 24-hour exposure, and it's set at 250 micrograms per cubic meter. So again, like I said earlier, the ecology, the 5-minute readings do not directly correlate to AQI. However, when you do detect repeated concentrations at significantly elevated levels, then it is something that we should clearly be paying attention to. And the general trend over the last week, since we've added, or Ecology has added these sampling sites, is to see these sites 1A, 2, and 3, so kind of on the east, north, and west end of the facility, as repeatedly having consistent readings that are pushing into the hazardous range, very high, very much over the 250 range there. So over the early part of this week, actually yesterday is the most recent data that I've seen. And it looks like due to some wind shifts, the readings were improving. I can't say what that looks like for whether that was pushing over into Kennewick or Pasco, but the readings in that area were improving. But it's too early to say whether that will continue. That may have just been an anomaly for that day. So having those purple air monitors get set up will be really critical, so we can see, are these just, the data we're finding from ecology, if something is spiking up into, say, the thousands or even higher, is that is it just spiking for 5 minutes, or is it staying that way for a long period of time? So getting those air monitors in place will give us a better idea of how long those concentrations are staying that high. Okay, and then I think I was gonna pivot over to Dr. Krager a little bit after that, so he can talk a little bit about what that means for health and add some of his take on it too.
Yeah, thanks, Aaron. I think that was an amazing summary of, yeah, a lot of the work that you all have done the last week and a half or so. And just from my standpoint, I just wanted to touch on a couple things, from kind of like a medical perspective, right? A physician perspective. It's interesting. Our last Board of Health meeting, we talked about wildfire smoke. That was one of the things we talked about, and a lot of the principles are the same. Obviously, this is a slightly different situation, and frankly, is going on longer than we would expect. Any sort of wildfire smoke exposure. So it's also more concentrated in a smaller area, but that also creates significant challenges. So the main points I wanted to touch on, we're most concerned about vulnerable populations. So people over the age of 65, people with heart or lung conditions, and children and pregnant women. Those are the people we kind of need to protect the most. We've heard anecdotally from that town hall that, yeah, some people have experienced, increased coughing, increased, issues with COPD. And that's a big concern from a health perspective. What we talk about, and this is what we talked about, with last month with the wildfire smoke, is, some of the actions you can do to try to mitigate that and prevent that. And I want to echo what, Aaron said. I think ideally, obviously, from a health perspective, the sooner this fire can be put out, the sooner that smoke exposure can just go away, that would be obviously the ideal situation. But we're trying to, reduce the harm from that smoke as much as possible. So especially during those spikes when we have high levels of that particulate matter that we're talking about in that smoke, we want people to stay indoors if possible. Especially if they have an air purifier or a filter with a box fan. That's the ideal situation. If you have to be outside, again, those most vulnerable populations, I hope we can find ways to keep people indoors. But if people have to be outside, using an N95 mask or higher kind of capability, those are probably the highest bang for our buck in terms of ways we can protect people. And just one other thing that I didn't touch on in our last Board of Health meeting, that particular matter that we're talking about, and this is what's being monitored right now, is this, it's called PM 2.5, and that is basically the smallest kind of type of particulate matter that we can measure. And if you just think about that from a practical level, when something is entering your lungs, the smaller it is, the further it can go into your lungs, right? So the deeper it can go, the more irritation that can occur, and the more exposure you can have to that particulate matter. So that's kind of why we're concerned about it, especially over longer periods of time. So indoor air quality is huge. I know we have like heat happening obviously today, and then kind of ongoing. It's going to depend on the type of air conditioner that you have, honestly, whether that's a good idea or not. If it's pulling air from the outside, usually those filters on air conditioners are not enough to filter that particular matter. So I can't speak to which particular air conditioners. You're going to have to kind of read the manual, and see if it's a good idea or not. Some other ways you can try to mitigate that are trying to like create, one room in your house that is particularly, clean, right? Or like, so you run that filter in that room. If you have an air conditioner that works, you close blinds. ways to keep, things clean and cool as well, if possible. Just one other thing I wanted to touch on, I think we've seen it. I will say this from multiple levels, just a great kind of outpouring of support from the community, as well as partners. And I just, I think that's really inspiring in a lot of ways. I also want to encourage, community members to continue kind of checking on those vulnerable people, whether they're neighbors or family members, checking in and seeing if, if you can support them. If we can provide some sort of support, we want to also offer that as well. Last thing I want to touch on, just again, I know I'm a part of Benton-Franklin Health District, but I'm also relatively new and I have a little bit of an outside perspective. And I just want to, give kudos to our team, just in the passion that they've shown in responding to this emergency. It's been really cool to see. I've had a lot of experience with other health departments, and I do just want to call out that they've been particularly impressive in the scope of what they're responding to, and how and the passion that they've shown. So that's kind of what I wanted to talk about. And I think I'm going to hand it back to Janae, but also I'm happy to answer any questions.
Thanks, Dr. Farrier. Okay, so that's a lot. I too want to echo what Dr. Farrier said. Our staff have been absolutely phenomenal in responding to our community's needs, and you, Commissioner McKay, not just representing your seat with the county, but also representing the Board of Health out there in the action and outreach and response. So thank you. What questions do you guys have about what's been going on? Yes, Carol.
Well, is there potential for a lawsuit?
So the county side, not on our side, but again, it's up to the people that are living there, or the community, on how they want to react to it and stuff. So with the count, but us commissioners signed a letter yesterday, and we sent it to Lineage to basically encourage them to. It should be happening you should have 24-hour service instead of just 12-hour service. And also, one concern was brought up about like the noise ordinance, like all cities and everybody has, but we, in our letter too, it specified there's no noise ordinance pertaining to this project. And when I was there, was it Wednesday when we did the massive first night? Yeah, Wednesday and Sunday, when I talked to 30, 40, 50 people, and every one of them agreed to where, yeah, it should be 24-hour service. I'd rather be listening to the noise at 1 or 2 o'clock in the morning, dealing with the smoke in my house and stuff. And I mean, even the fire chief lives 50 feet away from this project, and multiple people live right next door to the property. And so I can imagine, so that's why us commissioners yesterday signed the letter and said, hey, we need to encourage you guys to get this. But then also too, I heard that they're hauling 60 loads of semi loads. I believe it's to Arlington and one other location, can't remember the other location. So that goes to show that they are doing a mass, hauling off 60 semi loads a day. That's quite a bit. But again, from my side, I was pushing really hard to say, well, I get that you're only limited to so many truckloads a day, but you can still be spreading out the material and putting the fire out, and then keep loading it up. And if it takes, longer to load up, keep loading up, and let's get the fire out. So that was our encouragement. But then other than that, is really, I just appreciate you guys getting going. And like you said, Aaron, it happened 6 weeks ago on a Sunday. I left work, I see the smoke, and then 3 weeks later, I'm like, why is this fire still going? And that's when us commissioners and you guys started getting more involved. We were like, hey, and talking to the community members too, every single one of them agreed that, okay, we get it taking 2, 3, possibly 4 weeks, because there was frozen product we found just last weekend, not this weekend, but the weekend before, so a week and a half ago. And so that goes to show how much product is in there, and how hard it is to put the fire out, because you can't come in there with helicopters and just douse it, because the fire is still hidden in the pile and stuff. So you're adding more water for well issues and down the road. So it's a complicated fire. I mean, but again, it's the 24-hour service, I think, would be a lot different. But it's grateful for Lineage now to get involved, saying that they're donating more masks and helping out the community more and getting more involved as well. So. But yeah, and some of that product was grease, like some of the potatoes were grease fried. So that's, it's in this, was it 9 acres or 10 or 11 acres?
He said 9 football fields. Yeah, it is a huge facility.
Yes, yeah, 9 acre building, so.
And then I don't know if you heard this morning, I heard on the KDU on the radio that they were actually talking about our letter, so it's getting some traction.
Yeah.
Letting cheers at, it's gonna put more pressure on them to do more.
Yeah.
So like I said, that was something.
I one person asked me the other day, like, well, how come you guys didn't jump on this a week after the fire? And I was like, well, this is one of the biggest fires in the Northwest that, that we've ever had. And so it's really kind of a first time for everybody in this community, firefighters, us, pretty much the whole state and Northwest to have a fire like this to where if it happens again, yeah, it might be a different situation, faster situation, maybe, I don't know. Rocky, you got any questions? Christian Malone, sorry. Anybody online have some questions?
Any board members online, can you pop up the participants?
No, I'm good. It sounds like you guys got it pretty well researched.
Is there, at this point, since Benton County did a letter, is there anything else the board would like from BFHD or even our health officer, Dr. Kreider, or do you feel like we're going in the right direction?
So I'll just add to that real quick, and you guys can add in a second. I think for us, with you guys communicating with, I don't know if you want to communicate with Franklin County too, but like with you guys working with Glenn Boggin on our side to help us out with websites or, just keeping both Franklin County and us, all the community members being able to get online. I think that's still beneficial, but also when we were handing out the masks, we were also handing out a flyer that had a QR code and website to stay on the Benton-Franklin Health District to keep us updated if we're doing another town hall or, hey, we're handing out Chick-fil-A tomorrow night. Sorry, it's just an inside joke. They know I like Chick-fil-A. So anyways, but yeah, so the health district website's the biggest one, but I think it's still beneficial if we can team up with you guys, both counties and just keep it on our county website too. So.
Yeah, absolutely. And I know Amanda, are you on?
Yes, I am.
Can you speak to that real quick in terms of the website and how we're working together there?
Yeah, absolutely. Funny enough, I'm actually updating it right as we speak. I've been working on kind of catching up after the Wasolfo meeting. Sorry, it's here. And what's really great about it is that we not only are putting on questions about drinking water, we're keeping an eye on that according to our team and what they're able to do. Again, a lot of this falls under different scopes, but what I'm doing is I'm updating the information anytime we have an event coming up, or if we did an event, what were the results? At some point, we're going to work on putting those, from my understanding, sit reps as well for those situational reports, just to kind of keep it up to date, everything that we're doing. And so I'm really grateful to McKay. Yes, we did have Chick-fil-A today. But no, we're very grateful. We're grateful for all your hard work, and all of our staff in the fire department. I mean, we were in the rain. I will say that my fiance and I were the ones that made the home deliveries for those homebound citizens, and it was definitely very heartbreaking to see and to hear everything that was going on. I apologize for the background.
We can see it all.
But we delivered a purifier to a woman with congestive heart failure and some other lung issues with limited eyesight and vision. And so just being able to make that contact, you could smell the smoke right outside of her home. And so these people are struggling, and all the work and all the effort that everyone is doing, including our staff, the commissioners, as well as the fire department and our friends at Ecology and Benton Clean Air. Really grateful for it to see firsthand.
And one thing I'll add to too, the fire chief brought up in our town hall, which I'm glad we did it. To be honest with you, I was very nervous about doing the town hall, but I'm glad you guys pushed it and we did it because it really helped out. But with that and with this meeting too, it just kind of educates us more because I was like, hey, chief, how come we weren't just on it like the day of? But again, there was pneumonia in there that we had to be careful of. Structurally, we had to be careful of. There was asbestos. So there's a lot of stuff in there that we couldn't just 500 people go there and put the fire out. We had to be very cautious and stuff. So it was a big time with safety part of it where the building could collapse if you had firefighters inside, and the investigation thing, I think that one took a little too long. I wish they would have got investigation going sooner, but so long story short, it was just a big project and you know, again, I'm glad we signed that letter just to kind of put some more pressure on lineage to, let's get this done, so.
So the question, so I mean, it sounds like the staff has done a Herculean effort to mitigate the circumstances, right? But so when push comes to shove, what is the health department's responsibility? I mean, because you're not responsible for the air quality. We can't control the air quality in our community. We can help mitigate it, but are we responsible for helping to mitigate the air quality?
Yeah, I can see Chris is teeing up there. I'll just say real quick, Carol, I'm glad you asked that because that's the questions we've been reflecting on is as we go through this to say, when it's a multi-agency response, maybe it's not any one agency.
Right.
Maybe it's the collective of us, but we should probably dig into this a little bit and better understand to what level. And so we did that earlier this week on Monday. Dr. Krager, Chris Mertens, Aaron and myself sat down to start that research and better understand. I know the county's been working on that too. Chris, do you have anything to add there to Carol on that, on our role specifically?
You know, not a great deal. I mean, I think everybody has accurately identified the fact that the issues relative to the air quality, of course, is the with the Benton County, air, and the other issues relative to the fire are going to be governed by the fire departments and what they can do. If it rises, to a level of a potential nuisance, in speaking with Benton County's prosecuting attorneys, the civil division, we both have come to an agreement that yes, I mean, there are the potential for actions, but nothing that's really going to take place from a legal standpoint that would force them to, do things quicker. I think that the court process would, take a considerable amount of time, and I don't know if that's the route to go. I do understand that Lineage has taken some further steps and is, working somewhat longer. And I think that, although there's some generalized authority of the health officer to abate nuisances that are damage to the public health, I just don't believe that that's a step that the health district should take at this point.
Thank you. Thank you.
That's a great question.
Any other questions?
Okay, so we'll keep collaborating, keep working together, keep responding to
Yeah.
Finley. I'll just add real quickly too, being at that town hall was a great experience, but then getting to be at the drive-through, seeing the shift for them.
Mhm.
That getting those things out there like masks and the air purifiers was something for them when they've had nothing for weeks. To talk to somebody or kind of address their concerns. So I've seen a shift.
Okay, let's move on to item 3.
Yes. So we threw this one in there. We've got Kyle coming up just because we want to get going on recruitment. So since we're having a meeting, Kyle.
You're gonna lighten the mood. So the Benton-Franklin Health District is proposing to add a 1.0 FTE to our youth cannabis and commercial tobacco prevention program. So a little background, this program has been funded by a subcontract through the Walla Walla Department of Community Health. And they are no longer going to be the lead program as of July 1st. BFHD is taking up that flag and running with it. So for that, with this contract comes funding for expanded staffing. One contract requirement for this is that we maintain a minimum program staffing level of 1.25, and this position will allow us to accomplish that. This 1.0 FTE will be a public health educator working alongside other program staff to implement local and regional prevention work through policies, systems, and environmental interventions. Additionally, this position will work alongside others within the regional network to deliver coordinated, consistent, and effective prevention of youth, cannabis, vape, and tobacco. This is a budget neutral position as all the costs associated with this position will be covered by the YCC TPP grant from the DOH. And you guys have any questions? Kelly Harnish is here to answer them.
Go ahead.
Kyle, does this position come with any requirements to measure, the effectiveness of the program?
Yes.
What are those measures?
One of the requirements is to perform a needs assessment this year, so that will be one step that we have baselined. And then we do have a complete work plan with 4 goals and coordinated objectives and actions. And so, yes, those are measured on a monthly basis and reported back up to the Department of Health. Included in those are changes in things such as discipline in schools for youth that are found with, paraphernalia of vape or cannabis. So that's a policy change. There's also measured differences in the environment, such as ordinances in public spaces. So non-smoking, non-vaping ordinances. Those are just a couple of examples, but we can easily measure the numbers of schools, signs, all those types of things that are implemented.
Thanks, Kyle.
Thank you.
Any other questions? Okay. Let's get a motion.
Move to approve one full-time employee public health educator for the youth cannabis and commercial tobacco prevention program.
I'll second that.
A motion and a second. Is there any discussion? Hearing none, all in favor, say aye.
Aye. Aye.
Any opposed? The ayes have it. All right, the ayes have it. Before we adjourn, any other comments or questions from the board?
I got one.
Yeah.
I noticed I don't feel so small in these chairs.
Yeah, we got rid of the disintegrating chairs. And we got some temporary chairs from Office Depot just down the way.
I actually fit.
Yes.
Okay, so when's our next, just to confirm before you adjourn, our next board meeting's
On the 26th.
the 26th of June.
Yep.
Correct? Yeah,
Yep.
okay, perfect.
Yep.
All right. Okay, and we'll have Chick-fil-A for the meeting. Okay.
Amanda, we gotta go back.
Thank you, Commissioner McKay, and don't forget to go to the website for more info.
Yeah. Wait, the Chick-fil-A website or the Benton-Franklin
Oh,
Health?
our website, yeah.
Oh, gotcha, okay, okay.
While we're eating Chick-fil-A, we'll keep updating it.
Okay, great.
Thank you.